let's get right into it. So what we're going to do tonight is NCLEX style questions, and we're going to discuss how to dissect, how to answer, how to do process of elimination. So I'm going to need your interaction. So the question reads, a nurse administer the influenza vaccine to a client in a clinic. Within 15 minutes after the immunization was given, the client complains of itching, watery eyes, increased anxiety, the difficulty breathing. The nurse expects that the first action in the sequence of care for this client will be to maintain the airway, administer epinephrine 1 to 1,000 as ordered, monitor for hypotension and shock, administer diphenhydramine as ordered. So in order to answer this question, you guys can take yourself off mute and answer, or you can use the check mark that's in the box to just tick where you think the answer is. What do you guys think is the answer? Anyone? Or you can put your answer in the chat box if you feel much more comfortable doing that. All right. Okay, so the answer is administer epinephrine 1 to 1,000 as ordered. So a lot of students may say, what? I thought it was airway. If you notice, it says the nurse expects that the first action in a sequence of care. So that means there are steps of care that need to be done first, but which one would you give? Now, this person has itchy eyes, itchy and water eyes, increased anxiety, difficulty breathing. So as the nurse, you anticipate that they're going to have an anaphylactic shock. These are the first signs. So because you anticipate that, then they will be given, okay, I think I passed my ear, let me see. Then they will be given epinephrine. You can look at the airway later, but the epinephrine will prevent any kind of anaphylactic reaction. So that is given first. So let's look at the rationale. Administer epinephrine 1 to 1,000 as ordered. All the answers are correct given the circumstances, but the priority is to administer the epinephrine, then maintain the airway. So in the early stage of anaphylaxis, when the patient has not lost consciousness or is normotensive, what normotensive means is that they have a normal blood pressure. Administer the epinephrine first and apply the oxygen and watch for hypotension shock or later responses. So the prevention of a severe crisis is maintained by using diphenhydramine, which is Benadryl. So again, you will give epinephrine first. So let's look at this question. This question reads, the nurse instructs the client taking Decadron to take it with food or milk. The physiological basis for this instruction is that the medication, 1, retards pepsin production, B, stimulate hydrochloric acid production, C, slows stomach emptying time, and D, decrease production of hydrochloric acid. Now, when it comes on to Decadron, when it comes on to the stomach acid, the acid is formed in the stomach and it breaks down food. So the acid contains what we call hydrochloric acid, potassium chloride, and sodium chloride. So when we talk about those, especially for the hydrochloric acid, it's within the stomach. And what it does, these actually activate the digestive enzyme that plays a role in breaking down protein. So the answer in this is B, stimulate hydrochloric acid production. So B, the answer is stimulate hydrochloric acid production. Decadron increase the production of hydrochloric acid, which may cause gastrointestinal ulcer. So think of this. The stomach is very acidic. The stomach is very, very acidic. And so when the stomach is acidic, then it can cause a lot more ulcers in the stomach. All right, any question about that? Any questions? All right, so
I don't have any question.
Okay, and I wanted to say what Decadron, thank you so much, Myrtle. So what I want to say about Decadron is an anti-inflammatory medication. And what it does, it relieves inflammation in various parts of the body. So when you have, swelling or any kind of inflammatory reaction, they will give Decadron. Decadron is like cortisol-like, all right? So it's also used to treat other kind of autoimmune diseases. Let's look at this question. A client received chlorpromazine, which is Thorazine, is in a psychiatric home care. During a home visit, the nurse observed the client smacking her lips alternately with grinding her teeth. The nurse recognized that this assessment finding is what? Dystonia, akinesia, bradydyskinesia, and tardive dyskinesia. So here's a question with this. The thing about this is that this is a knowledge-based question. You either know it or you don't. So sometimes students may say to me, how do I go about finding information when I don't know what it is? How do I answer the question to the best of my abilities? Here's what I tell students. Do not do eeny, meeny, miny, mo. Don't do that. Make an educated guess. The word this means many or dysfunctional. Let me say that. Dysfunctional, not working. Tonia is like muscle. So not working muscles, if you want to interpret it that way. So dystonia is a disorder characterized by involuntary muscle contractions. So that means it's not working as it should. So there is an involuntary muscle contraction. So for akinesia, A meaning what? It is a movement disorder and it's characterized by a feeling of inner restless, like they're compelled in the need of constant motion. They have to be moving all the time, constant motion. And then you have Brady. You know the history of Brady. Brady, like in bradycardia, Brady means slow. Remember earlier on, we say this means dysfunctional and kinesia is movement. So Brady dyskinesia is characterized by slowness of movement, and it can be linked to Parkinson and other disorder of the basal ganglia. Then we have tardive. Tardive, this is one of the most disruptive potential side effects of certain antipsychotic medication. Tardy mean late, right? Dyskinesia, this mean bad dysfunctional movement. So late, bad movement. Kinesia mean movement. Remember that. Tardy mean late. So if we should interpret what it means, it is as I mentioned, one of the most disturbing side effects of the medication, but it means late this movement. Here's why I, implore you to look at it this way. You're not going to remember all of this. You may not, but if you use what you know, this mean many, tonia mean muscle, many muscle, and this is uncoordinated muscle movement. Brady means slow, many movement. Tardive mean late, many movement. So the answer is, and I just read it out to you, that tardive dyskinesia is one of the side effects of psychometric medication. So what you will see is lip smacking. And what smacking the lips mean is like this. Smacking the lips, grinding the teeth, fly catching tongue movement. And these are often described as Parkinsonia. Even some patients, when they're on these medications, they have to give them anti-Parkinson medications because some of them will have the patient mimic as if they have Parkinson. All right. Any question about that one?
No.
All right. So let's go to the next question. Which of the following, I'm going to ask you guys, you can put the answer in the chat box if you don't want to audibly say it. Which of the following finding contraindicates the use of Haldol and warrant withholding the dose? Drowsiness, lethargy, and inactivity, dry mouth, nasal congestion, and blurred vision, rash, blood dyscrasia, severe depression, hyperglycemia, weight gain, and edema. So it says, which of the following is a contraindication with the use of Haldol and warrant withholding the dose? What do you guys think? You can put it in the chat box if you don't want to say your answer out loud.
I think number A, it's okay for me.
Okay. Okay. So if, say, for example, you don't know what Haldol is a psychometric drug, but say that you didn't even know that. What I know from the question that it's a contraindication, that means if whatever is going on with the patient, they should not get this. So if I don't know what the drug is, I'm going to look what in this is really bad that I cannot give the patient this medication. That means they're really, really, really bad. So drowsiness, okay, lethargy, inactivity. One of the things that will have me concerned is a lethargy, because lethargy is not normal. So I'll keep an eye on A. Then I'll go to B, dry mouth, nasal congestion. That won't harm the patient. And remember, the question says contraindication. So whatever it is, it must be really bad that can harm the patient. C, rash. Rash is an indication of this person may be allergic to it and can even end up in anaphylactic shock. In addition to that, blood dyscrasia. What this is a pathological condition or a disorder such as leukemia and leukemia, disease of the blood. So this abnormality. In addition to that, they may have severe depression. Someone with severe depression is at risk for harming themselves. So I'll keep an eye on C. So D is hyperglycemia, weight gain, and edema. They won't die from this. So they won't die, let me get my pen. They won't necessarily die from, they won't die from drowsiness. They won't die from dry mouth, sorry. They won't die from, let me clear this, They won't die from dry mouth. They won't die from hyperglycemia and weight gain. So we're between C and A. And how I look at it is which one is more dangerous? Which one will kill the patient more? Is it the rash with the potential anaphylactic shock, the blood dyscrasia like hemophilia or leukemia, severe depression, which the person's at risk for committing suicide? Is it drowsiness, lethargy, and inactiveness? Which of this do you think is more dangerous?
I think C is the most one.
C, yes. So it's actually C that is the answer. So I went through that step because I wanted to show you that whenever you have a question, you see, and you don't know like what the medication is per se, or really off the bat, you don't know what the answer is, You can use thing in the question like this. It says, what finding would be contraindication to use this medication? So I would look for the worst thing. What can harm the person more than anything else? So the answer is C. So rash, blood dyscrasia, and severe depression. Rash and blood dyscrasia are the side effect of antipsychotic drug. The history of depression is a contraindication to use a neuroleptic drug. All right. Any questions thus far?
I don't have any question.
Okay. So let's look at this one. The nurse is reinforcing teaching to a 24-year-old woman receiving acyclovir for a herpes simplex virus type 2 infection. Which of these instructions should the nurse give the client? Complete the entire course of the medication for an effective cure. Begin treatment and acyclovir on the onset of symptoms of reoccurrence. Stop treatment if she thinks she may be pregnant to prevent birth defect. Continue to take prophylactic dose for at least 5 years after the diagnosis. And this should be begin treatment with acyclovir on the onset of symptoms. Stop the treatment if she thinks she may be pregnant to prevent birth side effects, and continue the acyclovir dose prophylactically for at least 5 months after the dose. What do you guys think?
I don't think the first one is the best one.
Okay, all righty. So let me get this. Yeah, take the first one. All righty. What else do you think?
I think it's between C and D.
I think it's between C and D. Okay. All righty. So how would you differentiate? Tell me. Okay. So you say C. All right. And you say D. All right. Here's one of the things that I say to students. All right, tell me why you think it's not A. You say complete the entire course of medication for an effective cure. Why A is out of it?
I don't think herpes is curing.
Good job. Excellent. It's not curing. Okay, good. Why did you eliminate B?
You have to take the medication as soon as the doctor order it. You don't have to wait until the onset of the symptoms.
Okay. All righty. And I'm going to keep an eye on this one. Stop treatment if she thinks she may be pregnant to prevent birth defects. What do you think?
That's not a confirmation that she's pregnant. That's if she thinks. But maybe after the confirmation, maybe, but she just think it's not accurate. She doesn't have any proof she's pregnant.
Okay. So let me tell you what herpes is about. There are two types of herpes. There's herpes simplex 1 and there's herpes simplex 2. Herpes simplex 1 is above the waist, anywhere above the waist, mostly common on the mouth that they call like morning sickness. Herpes simplex 2 is anywhere below the waist, which is normally at the private part. So here is all I remember herpes, and I'm going to stop showing my slide for a minute, and I'm going to go on the internet. Here's how I remember herpes, what herpes is, what the signs and symptoms are, and how you can remember. Can you see my screen?
Yes.
I'm on the internet. You can see it?
Yes.
Okay. So you see me typing up herpes. I want to look for an image. Can you see the pictures of the people with the herpes thing in their mouth?
Yes.
Okay, all righty. Just want to make sure that you are seeing. So you can see this. This is like a cold sore. This is what we call like the herpes simplex 1. It's above the waist. It can be any part of the body, but it can be above the waist. It's above the waist. Herpes simplex 2. Herpes simplex 2, you should be seeing a picture of a male and a female private part right now. You see these fine bumps with the redness at the base. This is herpes simplex 2. All right. So sometimes baby can have it because of vaginal birth. So mother with active herpes infection, although active infection may not be apparent. So here's what I'm going to say to you with herpes. And this is what it looks like. Herpes again. This is a chancre. Now, one of the things is that herpes have outbreaks. A person, they do not get cured from herpes, but they have a time when it flares up. If the herpes is not flaring up, they don't need to take the medication during that time because it's not flaring up. But when it starts flaring up, then they will take the medication. It's just like asthma in a sense. I'm going to contrast it with asthma. When someone have an asthma attack, they use their inhaler. If they don't have an asthma attack, it doesn't mean that they don't have a history or a diagnosis of asthma. They still have a diagnosis of asthma, but it's just not attacking right now. So they don't need to use the pump. You get what I'm saying? Another thing I wanted to show you, herpes 2. I'm going to show you something. A way that you can remember what herpes signs and symptoms are. One of the things with herpes is that it is very painful because of the picture that you see, the blister. So the most herpes symptoms are sore either in the genital or in the mouth, but most of the time there's no symptoms. So people can have the herpes simplex without having any symptoms. So one of the sign, they will see gathering groups of itchy and painful blister. Now, what is commonly associated with herpes, or you will see them talk about herpes or syphilis. So how do you identify herpes from syphilis? And I'm going to show you a picture. I use this concept from I was in nursing school. And this is just a way for you to remember. It's by no way saying that when I was in nursing school and I couldn't figure out how to differentiate herpes with syphilis, I think of herpes as Hercules. Remember that. Herpes as Hercules. Why? The name rhymes, that's 1. 2, Hercules wear a skirt. And you see, Hercules stand with his foot apart. He has herpes simplex 2. Herpes simplex 2 is very painful. So he needs to wear a skirt. And he stands with his feet apart most of the time. Look at this picture, standing with his feet apart. Can you see Hercules on my screen?
Yes.
Okay, stand with his feet apart because he has painful blisters. So this is just a way for you to remember that someone with herpes will have painful blisters. Herpes, Hercules. What does Hercules wear? Skirt, and he stands with his feet apart. Why? Because it is painful. Because you have some sexual transmitted diseases like syphilis that are not painful. So you need to know which one is which. If one is painful, what it is. If one is not painful, what it is. And in this case, herpes is Hercules. Hercules because it's painful. He stands with his legs apart and he wears a skirt because it's painful. So herpes has bumps, blisters that are very painful. All right. I hope I was clear with that. Do you
Yes,
guys, do you understand what I'm trying to say to you?
yes.
Okay, so with that, I mentioned that someone can have herpes and do not have an outbreak, signs and symptoms. But when they're having any signs and symptoms, just like asthma, someone has a diagnosis of asthma, but they don't use your pump all the time. They may only use your pump when they're having an attack. It's the same thing with herpes, that the begin treatment with acyclovir at the onset of symptoms of reoccurrence. Okay, so that is the answer. Let me clear my thing here so that clear drawings. All right, so you get what I'm saying, right?
Yes.
So let me ask you something. Which one of these diseases have painful blister? Syphilis or herpes?
Herpes.
All right, I'm going to tell you something. Here is how I remember what syphilis, and this is by nowhere mean disrespecting anyone. It's just a way for you to remember. With syphilis, the name comes up Phyllis because it's rhymed with syphilis. And I gave this disease a character. One of the things is that Phyllis loves money. Money, especially copper color money. And the reason why I use that example is because somebody with syphilis, their hand middle has copper color looking. I'm going to see if I can find another picture and show you. So there's this lady, her name is Phyllis. Phyllis rhymes with syphilis. No disrespect to anyone, it's just a way for you to remember. And in addition to having copper color looking hand middle, there's also a chancre on the lips. They can have things on the lips. You should be seeing my screen right now. They will have a chancre on the lips, most likely. So their hand middle looks copper color. Their hand middle will look copper color. Their foot bottom too, but just to remember, Phyllis loves money, love copper money. So her hand middles are copper color looking. She will have a chancre on her lips. They do have peanut, and look at this. This is the genital area. There's a chancre on it. There is sore on the penis, and there will be sore on the vagina too. But I'm going to ask you this question. What differentiates the chancre or the ulcer on the penis for syphilis versus the ulcer on the penis and the vagina for herpes? What is the difference between both? How would you know which one is which?
The syphilis one is a little colorful.
Okay. Here is the hallmark sign. No pain. It is painless. Syphilis, no pain. Herpes, pain. Okay? That's how you know the difference between, especially if somebody have an ulcer on their private part and you're saying, okay, you don't have the test result yet, and you're saying, which one would the nurse anticipate? Would you anticipate herpes or syphilis? And it's painless. That would be syphilis. But if it's painful, then you're thinking about herpes. I hope I was clear with that one.
Yes.
Okay. All right. Can you see my PowerPoint now?
Yes.
Okay. So I'm going to stop and I'm going to share again. Okay. All righty. So you should be seeing my PowerPoint. So the answer is begin treatment with acyclovir at the onset of symptoms of reoccurrence. When the client is aware of early symptoms such as pain, itching, and tingling, treatment is very effective. Medication for herpes simplex do not cure the disease. They simply decrease the level of symptoms. All right. So I hope you take away something. Syphilis is painless. Copper color hand middle because she loves money. She have a chancre on her lips. A chancre even looks like herpes 1 come like that too, chancre on the lips. So when you want to differentiate herpes versus syphilis, is it painful in the private area or not? Okay. So let's look at this question. A 14-month-old child ingests half a bottle of aspirin tablet. Which of the following would the nurse expect to see in this child? Hypothermia, edema, dyspnea, or epistaxis? What do you guys think?
I know dyspnea is difficult to breathe.
Okay.
And hypothermia, the temperature is down.
Mm-hmm.
And
edema is?
Edema.
Edema is swelling, right?
Swelling by the excess fluid in the body.
Mm-hmm. And what is epistaxis?
I think bleeding.
Bleeding, good. So what do you think the answer is?
I think it's dyspnea.
Okay, I'm going to say this to you. Look at this. And I want you to follow me with this. I'm going to get my pen. So this is aspirin, all right? What does aspirin do? Aspirin does a couple of things. They give aspirin for pain, okay? They give aspirin for pain. They do give aspirin for fever, okay? And they give aspirin for blood thinning, right? Right? So normally they give it for pain. There's nothing about pain here. So we can cross off dyspnea. All right, you want to say that you can cross off edema. One of the things with dyspnea is that the patient will be exhibiting signs and symptoms, and dyspnea can be caused from any respiratory issue. Hypothermia, yeah, we say take care of fever, but it won't have them drop below a certain temperature. We say blood, or it prevents bleeding, or prevents clotting, I should say, prevents clotting. It thins the blood. Aspirin thin the blood. That's why for people, they'll tell them to get aspirin a day, 21 milligram. Aspirin a day, it thins the blood. So this is a 14-month-old child. Here's one of the things, as the child liver starts to mature, one of the things, if they take aspirin, they may bleed. And one way they may bleed is by epistaxis. All right? One of the ways that they may bleed is epistaxis. So two things I look at here, I look at hypothermia and I will look at epistaxis, because I know that aspirin can lower the temperature. Look, if someone has fever, it will lower the temperature. But if someone don't have fever, it's not going to affect them, because look at someone who have a heart problem and they take aspirin daily. They take aspirin daily, they don't have hypothermia. So I'll cross out hypothermia. Dyspnea, yes, some drug does, but people take aspirin once a day and they don't have dyspnea with it. What it may, because it's in the blood, it may cause epistaxis, which is bleeding off the blood coming from the nostrils. All right.
That's okay.
Okay, so the answer is D, epistaxis. A large dose of aspirin inhibits the prothrombin formation and lower the platelets level. With an overdose, clotting time is prolonged, hence the person may bleed. So let's look at this question. An 80-year-old client with digitalis reports nausea, vomiting, abdominal cramp, and halo vision. Which of the following laboratory results should the nurse analyze first? Potassium level, blood pH, magnesium levels, blood urea nitrogen. Which one do you think? Which one do you guys think? You can put it in the chat, or you could verbally say it. Okay, so digitalis is one of the main cause for digitalis is potassium level or low potassium level. Anyone know what the potassium level is? What's the level for potassium? This is another thing that, go ahead.
135 to 145.
That would be for sodium.
Sodium, yeah, 35 to 45.
35 to 45. Well, that's here it is. Some book will say 3.5 to 4.5. Or some book will even go up to 5. All right, that's potassium level. What about blood pH?
I know as the pH goes up, as the pH goes, the patient goes, except for potassium. If the pH goes up, everything goes up. If the pH goes down, everything goes down, except for potassium.
Okay, so let me ask you, what are the levels? What are the potassium? What are the blood? What is the blood pH level? Blood pH, and remember this.
20. I know bicarb is 20 to 26 pH.
735, 745.
Yes, 7.35. And look at the potassium level. It's just, if you remember this, look at this. So it's 7.35 to 7.45. So one way to remember it, look at this. See how close it is to it? So blood pH is 7.35 to 7.45. So the lower the pH is, the more acidic it is. The lower the pH is, the more acidic it is. All right. What about magnesium level? I know a lot of students don't look at mag level. Mag level is 1.7. Anybody else can tell me to how much? To about 2.2. All right, what about blood urea nitrogen, which is called BUN? What is that level? Anybody? BUN is from 8. You will see some books say 20, but some will go up to even 24. 24 is considered normal for some. So you will see 8 to 20 or 8 to 24. So what I want you to take home is that low level of potassium, that means lower than 3.5, can cause digitalis toxicity. Okay, so let's go to the rationale. So the most common cause of digitalis toxicity is low potassium level. Client must be taught that it's important to have adequate potassium intake, especially if they're taking diuretics. So imagine Most of the time, someone take digitalis because they have heart failure or a heart problem, right? And people who have heart failure, heart problems, especially congestive heart failure, they may be taking digitalis and they be taking Lasix. Lasix is a potassium wasting diuretic. What that means is that Lasix make potassium leave the body. So if that person is taking Lasix, which causes potassium to leave the body, then they're taking digitalis on top of it. Low level of potassium will cause toxicity. And here's something I want to show you when you're studying. When you're studying and even doing questions, because look at this question. It says an 80-year-old client on digitalis report nausea, vomiting, abdominal cramps, and halo vision. Guess what? All of those are signs and symptoms of digitalis toxicity. So bank that in somewhere in your memory, that signs of digitalis toxicity, especially early sign of digitalis toxicity, is nausea, vomiting, abdominal cramping, and halo vision. All right. So the next question. A 42-year-old client refused to take Inderal as prescribed. Which client statement from the assessment data is likely to explain his non-compliance? I have problem with diarrhea. I have difficulty falling asleep. I have diminished sexual function. I often feel jittery. Which one would indicate or would describe or explain the reason for his non-compliance? All right, say for example, you don't know what Inderal is, and here is this. Let me get my pen. Let me get my pen. So whenever you say this, laugh out loud, LOL. What I always, and this technique I use from in nursing school, I say you better laugh out loud. You better laugh out loud. Beta are beta blockers. These are used for high blood pressure, for treating high blood pressure. These are beta blockers. So for me to remember what kind of medication it is or what classification it falls under, once I see LOL, I say laugh out loud. So I say you better laugh out loud. I know that it's a beta blocker. Now, beta blockers used to treat hypertension. Now, say that you did not know that it's used to treat hypertension. You had no clue what the medication was. You want to use an intelligent guess, if I may say. This is a male client. Some of the time when they're giving you a question, they won't tell you if it's male or female. So if they put a male inside there, if they distinguish and tell you it's a male or female, it's for a purpose. So what I would have chosen if I had no clue of what the medication was, I would look who the patient is. He's 42, in his prime, he's a male. Sex means a lot. I have diminished sexual function. Male will stop taking the medication for this. Okay. So that is the answer, but I'm just saying to you, if you do not know what the medication is about, if you do not know, how to answer it, look at who the question is about, a male. All right, and you can use that kind of process to answer the question. Okay. Any question about that?
You're completely right.
Okay, so I'm going to go to the rationale. So I have diminished sexual function, Inderal, a beta blocking agent used to treat hypertension. prohibit the release of epinephrine in the cell, and this may result in hypotension, which will result in a decreased libido and impotence. So this is a last question that we're gonna do, and then I want to show you something about our services. So this question reads, the nurse caring for a 9-year-old child with a fractured femur is told that a medication error occurred. The child received twice the ordered dose of morphine an hour ago. Which nursing diagnosis is a priority at this time? Risk for fluid volume deficit related to morphine overdose, decreased gastrointestinal motility related to mucosal irritation, ineffective breathing pattern related to central nervous system depression, altered nutritional related to inability to control nausea and vomiting. What do you think the answer is?
I think overdose is life-threatening, and it requires immediate emergency.
Mm-hmm.
It's not it's not D.
Okay.
It can be A or C.
So let me get my pen. So you say it is not D, not B. So you're thinking A and you're thinking C. All right. So let's look at it. So the nurse is caring, so that the child overdosed of morphine, and the fact that it is a child, a 9-year-old child, is even make it worse to get 2 times a dose. So here's what morphine does. Morphine can actually suppress the respiratory system. That's why even people in hospice, I know there's a notion that when they want to kill somebody, they give them morphine, which is not true. But if someone have, it lowers the respiratory rate, yes, and that's one of the side effects. And because that's one of the side effects, this is what you'd want to look out for. This would be a goal, ineffective breathing pattern related to central nervous system depression, because one of the side effects of morphine is a central nervous system depression. So respiratory in this case is a life-threatening thing. So yes, there's no risk for fluid volume deficit necessarily. Yes, they may have some altered mobility, or they may feel nausea, because nausea and vomiting is one of the side effects of someone getting morphine. But it is not a priority. It's not a priority. Respiration is a priority. So in this case, the answer will be C. And the rationale is ineffective breathing pattern related to central nervous system depression. Respiratory depression is a life-threatening risk in this overdose. All right. Any questions for me? So before we log off, I wanted to show you a little bit about our program. So I'm just going to ask you if you could spend 2 minutes with me just to show you what our program looks like. So we have, and let me share my screen with you. We have an online program, and for nurses who purchase a program, it will look like this. So what we do is, once you purchase it, and today we have a sale, once you purchase it, you will see, and you log into your account. When you log in, you go to My Library, and then you will see what's in your library. So there will be a welcome video. In addition to that, there's a pre-test. There's 100 questions in the pre-test. So we give students the pre-test just to see where they are when they're coming into our program. And we say if a student come in and do this test and get an 80% without using any kind of help aid, they can go take the NCLEX. This is a test to tell if you're ready, yes or no, but gaining an 80% on it will let us know that you're ready. So in week 1, the student will click on cardiac. When you go in cardiac, there's anatomy and physiology, there's a valvular disorder, there's heart sound, there's murmur, there's all sort of cardiac disease, premature ventricular contraction, heart block, pacemaker, shock, all those disease, anatomy and physiology. And then we have quiz. So these, like for example, anatomy and physiology, the nurse, the student can click on it, do that question to test his or her knowledge. And there are tons of quizzes inside here. And the thing about this, it is specific to the disease. So say, for example, you want to test your knowledge on pericarditis. Only thing you're going to test your knowledge on is pericarditis. You don't have to do a bunch of other diseases if you don't want to. So if you watch the lecture, you can then go ahead and do the disease. We have over 200 and something questions on cardiac alone. Then at the end, you have a comprehensive test on cardiac system. All right, let me see, so in addition to that, one of the things that I like with this is that if you are in your car and you're driving, if you're in your car and you're driving, you can play it. So let me play one of this for you. Can you, let me see. Let me stop sharing and then share again. Let's stop recording.